affects 10 to 30% of adults worldwide, and in some populations the numbers are still higher. As we all know that poor sleep is linked to fatigue, decreased productivity, impaired memory and even long-term risks such as hypertension and depression. So in such a widespread problem, choosing the right drug becomes crucial. While both Z group of drugs and benzodiazepines are capable of inducing sleep, but the difference in their effects can decide whether the patient wakes up refreshed and active or he wakes up dull and sluggish. So in today's session, we will be comparing the effects of Z group of drugs with benzodiazepines and why Z group of drugs are preferred over benzodiazepines in the treatment of sleep disorders. So to begin with the mechanism of action, both Z group of drugs and benzodiazepines act on GABA receptors in the central nervous system. As we know that GABA is an inhibitory neurotransmitter in the brain, and potentiation of GABA receptor increases the frequency of opening of the chloride channel, allowing the entry of chloride ions. So entry of chloride ions causes hyperpolarization, leading to inhibition of the neurons, and this induces sleep. So while benzodiazepines and Z group of drugs act on the GABA receptors, but the difference lies in the selectivity of the GABA receptor subunit. The Z group of drugs selectively act on alpha-1 subunit of the GABA-A receptor. So alpha-1 subunit of GABA-A receptor is activated by Z group of drugs. They have selective action on alpha-1 subunit. Whereas benzodiazepines act on multiple subunits of GABA-A receptor. The alpha-1 subunit that is responsible for sedation is activated. Also, alpha-2 subunit is stimulated, leading to anxiolysis. So it is used as an anti-anxiety agent. Also, alpha-2, alpha-3 that is responsible for muscle relaxation is also activated by benzodiazepines. While action on alpha-5 receptor produces anti-convulsant effect, benzodiazepines provide anterograde amnesia, which is why they are used as a pre-anesthetic medication. So benzodiazepines act on multiple subunits, alpha-1, alpha-2, alpha-3 and alpha-5 subunits. They have non-selective action on GABA-A receptor, whereas Z group of drugs have selective action on alpha-1 subunit. So this is the key difference between the effects of Z group of drugs and benzodiazepine. So let's move to the therapeutic uses based on the selectivity of action on GABA receptors. Now let's compare the therapeutic uses of both these classes of drugs. The Z group of drugs includes zolpidem, zaleplon and zopiclone, whereas benzodiazepines includes diazepam, lorazepam, alprazolam, temazepam and prazolam. While both benzodiazepines and Z group of drugs are used for the short-term management of insomnia, the difference lies in the selectivity of action. The Z group of drugs, because of their selective action on alpha-1 receptor subunit of the GABA-A receptor, they are mainly used as sedatives. They induce sleep and they are mainly used as sedatives. Whereas benzodiazepines have non-selective action on GABA-A receptors. They have action on alpha-2 subunit, alpha-3 subunit, alpha-5 subunit. So multiple therapeutic uses in addition to treatment of insomnia. So what are the other therapeutic uses of benzodiazepines? In addition to acting as sedatives and hypnotics, they also act as anti-anxiety agents. So they are used for treating generalized anxiety, panic disorders. Anxiety neurosis can be treated with long-acting agents such as diazepam, lorazepam, clonazepam, temazepam. Thirdly, they can be used as adjuncts in psychiatric disorders. For example, they are combined with SSRIs for the treatment of obsessive compulsive disorders. They can also be combined with antipsychotics for treating mania or bipolar disorders. Fourthly, they can be used as pre-anesthetic medication or inducing anesthesia. Now, benzodiazepines such as diazepam, lorazepam, midazolam can be injected intravenously to induce anesthesia. They reduce anxiety, they induce sedation, they cause muscle relaxation and therefore they act as pre-anesthetic medication and can also induce anesthesia. What are the other uses? They act as anticonvulsant because benzodiazepines such as diazepam, lorazepam, clonazepam, they are used for treating status epilepticus. It's a life-threatening condition and they can be used for the treatment of status epilepticus for controlling seizures. The other uses that benzodiazepines such as diazepam can be used to reduce withdrawal symptoms that are associated with alcohol withdrawal. They can also be used as a muscle relaxant to reduce spasticity that is associated with multiple sclerosis or tetanus. So by acting on the spinal interneurons, by acting in the brain, the central nervous system, in the spinal interneurons, they act as a muscle relaxant. So it acts as a centrally acting muscle relaxant. So these are some of the uses of benzodiazepines. Because of their non-selective action, they have multiple uses, whereas the said group of drugs are only confined to the sedative action. They are mainly used as sedatives for the treatment of insomnia. Let's see what are the effects of Z group of drugs and benzodiazepines on different stages of sleep and their clinical significance. Now, sleep is divided into non-REM, REM. Non-REM constitutes, it is subdivided into 4 stages, stage 1 to stage 4. Stage 1 constitutes only 5% of the sleep time and it helps to initiate sleep. So, the person is relaxed but wakeful and any disturbances in this phase, in this stage, leads to sleep onset insomnia. So, difficulty in falling asleep if stage 1 is impaired. Now, stage 2, which is light sleep, constitute majority of the sleep time, that is 50%. So, stage 2, majority of the sleep time, light sleep, that is the person is rested but he can be easily aroused. And this provides rest to the muscle and brain. Stage 3 and 4 is deep sleep. So, deep sleep, slow wave sleep. This is important for physical restoration, tissue repair, bone and muscle growth, and also strengthening the immune system. So these are the 4 stages of non-REM sleep. REM sleep constitutes only 20 to 25% of the sleep time and REM is responsible for learning and memory consolidation. So any impairment in REM sleep can lead to rebound REM, that is after withdrawal, and also vivid dreams and increased brain activity. So learning and memory is impaired if REM is disrupted. So let's see what are the effects of Z group of drugs and benzodiazepines on the different stages of sleep cycle. So Z group of drugs act on stage 1. They help in the management of sleep onset insomnia because they have a rapid onset of action, short half-life, they have selective action on alpha-1 subunit of the GABA A receptors, they are useful in sleep onset insomnia, whereas benzodiazepines are preferred for the maintenance of sleep because of the long duration of action. Now, to be noted that most sedatives and hypnotics such as benzodiazepines and barbiturates prolong stage 2 and they suppress stage 3 and 4, which is deep sleep. So deep sleep is suppressed and stage 2 is prolonged by most sedatives and hypnotics, particularly benzodiazepines and barbiturates. Now for Z group of drugs, the advantage is that they have minimal action on stage 2 and they have minimal suppressive effect on stage 3 and 4. With respect to the cognitive profile, the Z group of drugs have better cognitive function. They do not impair learning, memory because they have less effect on deep sleep and REM sleep. Whereas benzodiazepines, they affect the deep sleep and they impair cognition. They lead to fatigue, they impair coordination, reduce alertness. So this is what is seen with benzodiazepines because the deep sleep is affected and REM sleep is affected. So better cognitive function with Z group of drugs over benzodiazepines and therefore they are preferred. Now with respect to the duration of action, the Z group of drugs act rapidly and they have a short half-life. So the duration of action is short and they act quickly within 20 minutes. So Z group of drugs are preferred for sleep onset insomnia and the hangover effects are less. There is less daytime sedation, with Z group of drugs, whereas for benzodiazepines, particularly intermediate and long acting, they have a long duration of action. The half-life is long, therefore they can produce daytime sedation. The hangover effects are seen with benzodiazepine group of drugs. It is also important to note that tolerance and dependence is more likely, more common with benzodiazepine group of drugs, which develops within weeks of initiating the drug. Whereas dependence is less likely with Z group of drugs, the chances or the risk of withdrawal symptoms are less common with Z group of drugs than benzodiazepine group of drugs. Lastly but not the least, benzodiazepine increase the risk for drug-drug interaction. They are metabolized by hepatic cytochrome P450 enzymes and they act as inducers of hepatic enzymes. When administered with other drugs that alter the metabolism by cytochrome P450 enzymes, the risk for interaction is increased with benzodiazepines. Also, benzodiazepines have a long half-life, long duration of action. They stay in the body for a longer time, which increases the risk for interaction. And secondly, active metabolites are produced with benzodiazepines. For example, diazepam, flurazepam, they produce active metabolites. So they remain in the body for a long time, greater effect on the body, and this increases the risk for drug-drug interaction. Z group of drugs, on the other hand, they have a shorter half-life, rapid onset, and also remove from the body quickly because of their shorter half-life, and the action is non-selective. They lack action on multiple subunits unlike benzodiazepines, and they do not produce active metabolites. Unlike benzodiazepines, they do not produce active metabolites, so they are removed from the body quickly after producing action, and therefore Z group of drugs carry less risk for drug-drug interaction. So this is another advantage of Z group of drugs over benzodiazepines. So to conclude, the Z group of drugs are preferred for sleep onset insomnia and benzodiazepines are used for sleep maintenance, and also there are other uses such as muscle relaxant, anticonvulsant, anti-anxiety effect, pre-anesthetic medication, general anesthesia, induction of anesthesia, whereas the Z group of drugs are mainly used to produce sedation. They act as sedatives. The hangover effects are less with Z group of drugs, less daytime sedation, improved mental alertness. The person wakes up fresh with Z group of drugs. So these are some of the advantages of Z group of drugs over benzodiazepine group of drugs. So thank you so much for watching. If you like my video, please share and subscribe to this channel.